Now you are able to see that this is the bone model. For this particular exercise, we have prepared a foam type of a soft bone. So this is a bone which has been made, which is a soft one, which has got no medulla. But just to mimic that, this could be the proximal end of the tibia, and we may not use a big drilling machines or drilling tool. So we can pass through with the hand only. So this is how I'm going to show you on this particular soft model how we can pass. Here you can see it is a lateral side, and if this is the bolt, if this is the bolt, then we have to see that the bolt is proper, which is little bit away from the capsular insertion. So we try to find out somewhere where it is possible to use 2 bolt if there is a big fracture, maybe anterior and posterior, or maybe only middle, or and also superior and inferior, whichever the way. Now, if you look at on this side, you will be able to see that again it should come out like parallel to that and not too much proximal to the joint and too much distal to the joint. So here what I am passing is first the Gujarat guide. And with the drill you are able to pass through this very easily. Here I am using my hand only because they are soft models. I am using this T handle. It seems like that it might hurt me. You are able to see that it is gone all the way. Now, I'll just push it a little more. Okay. I'll show you some of the pictures on the patient as well. Now, what we have to do is we have to just apply this on this side, whatever the drill you have, and then you have to put this blunt guide pin over here. Hold it. So now when I remove this, go on pushing it. So this is how we have passed the main guide pin. Thereafter, you can just use the drill. Now, drill is also going to make the passage in the soft tissue as well as the medulla and the cortex. So this is important because making a soft tissue passage with the drill, you'll be able to put the depth gauge valve. Because putting depth gauge at this particular time, the soft tissue may not be allowing you to put it. Okay, hold this. No, hold the whole fragment. Okay. Now, if you look very carefully, I'm going to go right up to the opposite side, and maybe a little bit of the tip of the drill bit can be seen, the cannulated drill on the other side. Now push it fully. Now I'll try to see that on the opposite side I'm able to see that it has come out of little bit of the screen. Now you can see very well that it has come out on the opposite side. Now this is sufficient. Now this is the stage where again you have to check that the reduction is good and probably your whatever is the clamp which is there, it is already applied, or maybe another additional KY you have put, so everything is good. Doing all these things should not displace your reduction. You have to be very careful. Now thereafter we are going to first check with the size. So we put the stopper over here, and then on this side we are going to check the size. So here how you can check, so that because of this stopper you will be able to get the best size. Okay. Now somewhere I am getting around 68. So whatever the size you are getting, you have to add take one higher side. So if I am going to take this 68, I think this would be proper side where I'm going to get a good compression. And this is the female part. So by and large, what I do is I recommend that if it is a medial condyle, then on the medial side you put the male part, and on the lateral side you put the female part. The reason is that we want sliding of this. This also can slide, but the side which we want to slide, you put a male part. Now I'm just going to make the passage complete with the tap. So here something is holding, and then this. And in the tap also you can go right up to the opposite side. And sometimes it cuts more with the opposite direction also. This is a cut which is not like a real thread, but it is making a passage which necessarily should be gliding the Ahmedabad bolt. There is no part of the Ahmedabad bolt which is catching the bone. It is sliding. So all catching is between the two components. Once they are engaged, then they create a compression. So this is how you are able to go on up to the opposite side. Sometimes if you have a doubt, you can check under IRTV that things are going exactly where we want. Here you are able to see now. Tap has come to the opposite side. See, this much you have to do. If you are not sure of this, then maybe the engagement would be difficult. If not, you have to unwind because it is a smooth passage which we have created. Now the last stage is very simple. On one side, you pass this bolt, okay, and use a long screwdriver. Now on the other side, you pass this female part, and maybe you are using a 1800 type of a small screwdriver. Okay. Now this one which I have already made a very good passage, so I am able to slide it very easily. Now like this, necessarily they should engage inside. And if you don't get a feel of engagement, that means probably your size of the bolt is not perfect. So this is the 53 one which I had just shown you for the demonstration. But when I check the original side, it is like this. So this is the original size for this particular model, for which I am just passing, and I will be able to see that there will be some engagement between these two. Now I am able to see that there is something which is left out. So I'm touching this side, and then once I try to catch it, now I'm catching the engaging the both the components, and now once I go like this, it will try to compress the fracture. This is how it has compressed the fracture. Now if you see very carefully, I'll be able to make it like this. This is because there is a good engagement between the two components, and that is how we are able to see like this. So whatever is needed, I just try to make it a complete, and this is how the fixation is done, where you will be able to see that it is very well aligned both sides, over here, and it is little distal to the capsular attachment, and where we want a subchondral. So if you look at the X-ray, this would be the best size which we have put. I think all these things will clear the doubts, and there are chances that you might have to pass the second one from here, or maybe if you have passed little anterior, then it may be the posterior part. So depending on the case. So I think whatever I just wanted to show on the model, that part is now complete. It is very easy. Much in the same way, when you want to remove this bolt, you just try to put this blunt guide pin on this, and then you have to use these two screwdrivers. Without using this two screwdriver, you won't be able to disengage them. And here, now once they are engaged, then I can just do like this, and I can disengage both the components, and then with something like an artery forceps or whatever, you can just take them out. So removal is not that way very difficult, unless you have over tightened without a proper size. But usually I had yet not faced any problem, and only one case I had to remove. Otherwise, usually we have not to remove this. But in all those cases where there is a post-traumatic arthritis, we want to go for a knee replacement, naturally we have to remove all these implants. In those cases, using this two screwdriver, it is very easy to remove.